Here are the Atlas answers today with Lauren, and we're going to talk about blood pressure. So what are some common things that we can look for to know that my blood pressure is high?
Well, you may come in with headaches, dizziness, maybe some chest pain. Also, if you have consistent readings greater than 140/90, it's another indicator.
So if my blood pressure is running 140/90, should I call the emergency room?
No, that would be a time where you could call the office, make an appointment, let's evaluate, and then go from there.
At what point do you think I should call the emergency room or go to the emergency room?
If you're having blood pressures greater than 180/120 and you're having, well, with or without symptoms, definitely need to seek care there.
Okay. And some of the red flags that I need to be looking for. So if I check my blood pressure and it's 180/120, what are things that are, it's time to hit the panic button, time to go to the ER?
Chest pain, shortness of breath, dizziness, lightheadedness, blurred vision, any tingling, numbness.
Okay. And especially if somebody comes in, one of the things that you worry about is they say, I've got the worst headache of my life, and you check their blood pressure and it's really high. Do we just let them drive to the emergency room?
No, we would recheck it. Sometimes we will give medicine in office and then call EMS to take them there.
Yeah. We want to be real clear that if your blood pressure is getting that high and you're having any of these red flags, it's not necessarily something that you should be driving yourself. You either need to have 911 come get you or have somebody take you to the emergency room. One of the things that we always worry about with really high blood pressure would be if somebody were to have a stroke. And if they were to have a stroke, we definitely do not want them driving. Some of the things when people come in and the blood pressure is high, but it's not so high that they need to go to the emergency room. And what are some of the things that we're really trying to tell people? These are the things that we're looking for long term, that we need to control their blood pressure instead of just continuing to let their blood pressure stay in that 140 to 170 range.
Well, long-term effects of it staying that way and not being treated could lead to kidney disease, heart disease, or stroke, like we mentioned, heart attack. So obviously we want to get that under control and stay under control so we don't have those issues.
Yeah, I think, a lot of times just thinking about that muscle and having it work that hard, the muscle just gets really thick. And that muscle is thick and the blood supply to that muscle doesn't get bigger, then it really puts people at risk for having a heart attack. And then also just, when we start talking about heart disease and kidney disease, that high pressure just doesn't do well with the pipes. And for us, the pipes are obviously our blood vessels, and those really small blood vessels show up a lot of times in the eyes, in the brains, and in the kidneys as far as having problems, because that's where a lot of the filtering goes, and that's where really those small blood vessels are just so important. I mean, our brain needs a lot of blood and a lot of oxygen. So blood pressure, if it's 180 or 120, seek medical attention immediately. A very high blood pressure with any of those red flags, we need to be seeking medical attention quickly. And anything that would be in that, what we would call stage 1 or stage 2, that 140 up to 170 range, make an appointment with your primary care physician. Right? There are a lot of medications that can help. There are also other things that we can do if the blood pressure is in that what we would call stage 1 hypertension range, that we can do without doing medications to help bring blood pressure down into a place that long term prevents heart attacks, prevents strokes, prevents kidney damage.